Sixth one. This was the repeated question. This 2020 paper has both May and November INI, so some of the questions will get repeated. So I thought of putting the same question again because you will know which question is repeated. A muscle is attached to the area marked in the given image. What is the action of this muscle on hip joint? See, it is the again this marked structure is the gluteal tuberosity. It helps in it is the extensor compartment muscle, so it helps in extension and lateral rotation. So option is D. Next, seventh question. Given a model of embryological development of the heart, which structure develops from the marked A? They have marked this one. What is that contribute to their asking? So it is the C. This is the bulbous cordis. This is the proximal one third, middle one third, and the lower one third. This is the they have marked. This is the atrium and this is the ventricle. This ventricle goes down and atrium comes up. But they are asking this area. So this is nothing but the middle part, which is nothing but a smooth outlet of the heart ventricle that is develops into infundibulum. Let's see the heart here. At 20th day, two tubes will be there. Then on 21st, it will fuse. Next on 24th day, they will rotate. Okay, the atrium will go up and ventricle comes down. Since this atrium has gone up and formed the atrium, this is the truncus arteriosus and this is the aortic arch arteries. And this is on the 35th day. Here you can see this picture properly. See, this is the proximal end and this is the distal end. If you remember that, this will be easy. So sometimes if they ask proximal end of the bulbous cordis develops into, so that time you should know which side is the proximal. So um, see, if my hand is this will become a proximal and this will be distal. So you remember raising the hand. So you have to remember this is the proximal and this is the distal side. Distal end one third will form a truncus arteriosus, that is ascending in pulmonary trunk. Okay. The middle part forms a smooth outlet tract, that is the infundibulum, that is also called as conus arteriosus or conus cordis. Whereas this is near to the ventricle, right? So it will form a trabeculated part of the right ventricle, and this primitive ventricle, primitive atrium, this will go up and this will come down. So this is the sinus venosus. Understood? This is the hence middle part will form a infundibulum, that is smooth outlet. This is also a repeated question, eighth one. Which of the following arteries passes close proximity to the area marked in the arrow? They have marked pterion. We have already learned that if there is fracture of this area, which artery will get injured? This is the middle meningeal artery. Ninth one, the type of middle meningeal artery, if it gets injured, which type of hemorrhage can be seen? It is extradural hemorrhage or epidural hemorrhage. Ninth one, the type of fibers present in the fornix. So they are asking what type of fibers are present. If this is the fornix, there are most of the fibers are nothing but association fibers. That means they are helps in association within the same cerebral hemisphere. Whereas commissural fibers, this will helps in opposite hemisphere of the same location. Like if in right it is supplying this region, in left also same region only it has to supply. Let me read out the explanation for you. Fibers present in the fornix are um, association fibers except the hippocampal commissure of the fornix, which has a commissural fibers. It supplies connects the corresponding region of two hemisphere, whereas association fibers connects various cortical region within the same hemisphere. Okay, various cortical region but same hemisphere. Next, coming to the 10th question. So answer for this is A. Which of the following marked structure does not form a part of laryngeal skeleton? So they have marked A, which is the hyoid bone. B is thyroid cartilage. C is the arytenoid, and D is the cricoid. All this thyroid, cricoid, arytenoid all forms a laryngeal skeleton except hyoid bone. You can see here. Epiglottis also forms a laryngeal skeleton. Cuneiformis, corniculate, and triate and apex of the arytenoid cartilage will have a elastic cartilage, whereas a thyroid, cricoid, greater part of the arytenoid cartilage has a hyaline cartilage. All this together forms a laryngeal skeleton. Thank you.